Games are designed to encourage people to go out and be more physically active through the use of gamification. The most famous example being Pokemon Go, that sort of blended the virtual gaming world with the physical environment. But exagames aren't taking advantage of these advances in IoT, such as proximity detection, or AI, like object recognition, or 5G connectivity. So that's what we're aiming to do with Tag With Me. So Tag With Me offers location-based treasure hunts that use proximity detection to understand where people are. So these are venue-specific, so they take advantage of the points of interest, such as sculptures in a park or the local history where the game is being played. So as you can see on the app, there's a number of locations that you have to try and find, and you can tap each of these to get a clue and really gamify the whole experience of being active. You can also see your points and the number of locations you've visited and your step counts while playing the game. And then you can start the treasure hunt from any location to make it a bit more accessible, and you can find any of the locations in any order, unlike sort of a traditional treasure hunt. And once you reach one of the locations, there's an interactive activity to really keep people engaged. So we use the proximity detection to understand where people are located. So here short-range wireless signals like Bluetooth and Wi-Fi are used, and the app continuously scans for these and calculates the distance based on the RSSI value. This distance is then translated into on-screen text, so it starts off as keep walking when you're far away from the locations, and then moves over to like getting nearby, then very close as you're within a few meters of one of the locations. So while this isn't as accurate as like location-based systems such as GPS, it's significantly more power efficient. So if the game is played for multiple hours at a time, it doesn't have such an impact on battery life. And it works both indoors and outdoors, so it can be used to give like an educational experience in like a museum, as well as promote physical activity in like outdoor parks. So as I mentioned, once you reach one of the locations, there's an interactive activity. So the first of these is Teach Me. So this can provide location-relevant information because we understand where the user is located. So it could be information about the exhibit you're looking at in a museum or the area of the park that you're stood in. And this means it could be used to provide like an automated guided tour. So as you're walking around an attraction, you keep getting the information about what you're looking at. Or if it's a location where it's to be played multiple times by the same people, the information can be randomized, so you see different facts each time you play, like about the local history or any other sort of information about the area. So the second activity builds off the first Teach Me activity. So it's really a multiple choice quiz. So this gives location-relevant questions again, so you use your surroundings to try and answer the questions, or it can build upon the Teach Me activity where you've previously learnt some information and then you get tested on that knowledge here. So it provides an educational aspect as well as the physical activity part of the technology. So the third activity is Tag Me. So this is where players are encouraged to search for and find a nearby hidden tag. So this encourages people to really explore the surrounding area and continuing to promote sort of exercise. And then the final activity is sort of the most technically advanced. So it uses artificial intelligence for object detection. So because there's sort of a lot of unique points of interest in these sort of venues like parks and museums, we can train a model using these unique points of interest. And then once you reach one of these locations, it will tell you the object that you need to try and find, and then automatically launch the camera. And the camera will then constantly be inferring what it sees from the camera view. So this just shows how AI can be used to sort of gamify the experience and also be used for entertainment purposes to encourage people to continue walking. So to get the model to be as accurate as possible, we used a process called transfer learning. So AI models trained with sort of thousands of images, and then we adapt to that model with the images unique to that location where Tag With Me is being implemented. So this allows the accuracy of up to sort of 99% to be achieved, and can also leverage 5G because of the reduced latency. So we're continuously scanning in real time. So 5G is really beneficial here. So now I'll pass over to Will, who will talk more about the venues where Tag With Me has been implemented.
Thank you, Kieran. So our first implementation is a product that came as a collaboration with DCMS 5G Connected Forest. It's based in Nottinghamshire County. It was with Nottinghamshire County Council as well. So it's called Tag in the Park, and it's based in Rufford Abbey Country Park near Sherwood Forest, and it currently has hundreds of downloads. So the history of Rufford Abbey Country Park dates back to 120 AD and has ties to the Romans. So as you can imagine, there's a lot of history and a lot to learn about the area. So we wanted to utilise advances in IoT and 5G. So we designed a virtual treasure hunt that Kieran explained to encourage users to explore more. So on screen, you can see a map of Rufford Abbey Country Park, and this is the route that visitors currently take. So as you can see, there's a lot of area that isn't really explored and a lot of points of interest that we kind of want people to move to. So what we did is we implemented 16 different points of interest, and now if users find the most efficient route, this is what we're looking to cover. As you can see, there's already much more area covered and a lot more to explore. So we got a user to go around and play, and we developed a heat map of where they've covered. And hopefully you can see that on screen. You can see that they've covered even more than we anticipated them doing so. And you can tell that they've walked multiple areas repeatedly to make sure that they find each of the locations. So we used 3 of the previously mentioned activities. We used Answer Me. So what this does is once the user gets to the location, they kind of stop and they have to look around, look out for the environment and read information boards and try and answer the question that they are given on screen. He implemented some Tag Me activities, and this gets the user to stop and take in the scenery and just kind of like chill out for a little bit and have a bit of a rest. There are also Scan Me activities placed around, and this gets users to take a closer look at the variety of sculptures that there are in the venue, some of which they wouldn't ordinarily stop to take the time to look at. So there are benefits to both the visitors and Rufford Abbey Country Park themselves. So in terms of the visitors, they get to learn more about the venue. It increases their physical activity. A family-friendly one, it keeps children entertained on family days out, so there's no whinging. And it's an incentive, there's rewards as an incentive to walk further and find more locations. For Rufford Abbey Country Park themselves, it increases the visitor footfall, increases their revenue, and it increases the awareness of the venue itself. And it's not moving on. Okay. So to ensure that the application had the intended effect, we conducted a survey that was done once a user has completed the treasure hunt. And what we found that 80% of the users, when they were asked if the app was responsive to the locations, 80% of them said that it was, which demonstrates the effectiveness of the technology that we have available to us. 64% of the users found at least 3/4 of the locations, and those that found all of the locations spent upwards of 3 hours. Which on a usual visit without the app was more about 1.5 hours to 2 hours. And those that didn't find all the points of interest said that they would have spent longer if they had the time to, and would consider returning again to try and find all of them. So this demonstrates the success of encouraging further physical activity. 91% of the users that used the app said that it encouraged them to walk much further than they usually would, again, demonstrating the success of its encouragement. So the success of the app really has led us to be able to talk to other potential partners and venues. So this is where I'll pass you on to Jenny to introduce the second venue, Highbury Hospital.
Thank you. Okay. Morning. So I guess I've just joining Will and Kieran just to talk about my role and our collaboration for Tag for Active Lives. So this is something, so I come from a healthcare perspective. So I was quite excited about the app that we're using at Rufford Park and how that could be used in our environment and used with our service users. So just a little bit of context in the sense that I work across acute inpatient mental health wards, and that's adults and older adults and learning disability. And my team's focus really on improving inpatient experience, and we do that mainly by lots of meaningful activity, therapy, and kind of collaborative partnerships. So it was a really lovely opportunity because one of our really focuses is physical activity. So from a purely health perspective, the reality of the population that I serve and work with, you know, in terms of serious mental illness and kind of long and enduring chronic ill health, often, you know, is associated with poor life expectancy, reduced life expectancy, poor physical health. So though we're focusing on mental health and well-being, it's really important to think about physical health care as well. And we know lots of research and evidence that, you know, that actually being physically active obviously is good for your health, but it's a preventative measure. So there's lots of stuff around the public health agenda and health prevention in terms of healthy communities and populations, in terms of like preventing diabetes, supporting prevention of stroke and cancers. And then a lot in terms of our older adults, there's a lot of stuff around frailty and falls risk and the impact of that. So for me, it's any way that we can get our service users more physically active is only a positive in terms of their clinical outcomes. So, and the other side of that is I've just mentioned a couple of the other kind of national agendas that really push my role and what I do, and that I think this really links in nicely with, is this active hospital. So we're trying to create all the hospital sites that I work across that sense of embedding physical activity. So I think part of that is embedding that on site and encouraging people to engage. And how do we get people to move more and motivate them when that might not be their priority? And the sense that what brings in the social prescribing is, in terms of my green social prescribing link, the sense that the more we can get people outdoors, connecting to nature, you know, have that kind of grounded mindfulness, interacting socially with others, again, as you know, associated with lots of positive outcomes. So for me, it's two wins really. And I've just mentioned the personalised care as well, because a lot of the movement, so in terms of NHS long-term plan, this sense that in terms of social prescribers are sitting in primary care, and it's about connecting patients and service users to their local community providers that are local, tailored to their needs, you know, very recovery focused, very peer-led. So there's a change and a shift in healthcare, though, so it's about people being able to decide what activities they do to support their own health. So I think it's something we want to channel really and use this as a potential tool to support that. So how we got involved is obviously in terms of talking to the guys with TAG for me and the possibilities of what we could do at a hospital site. And what was really lovely is that they created TAG for Active Lives, which was very focused just on Highbury Hospital and just on our service users. So the content was designed together. It was very much, we brought our clinical expertise in terms of what was the content, what would be most appropriate. You know, we've thought about how people access that in terms of physically, if people are unable to get across the site, you know, in terms of where they might be in terms of their acute stage of their recovery. You know, we've been really trying to connect people at every point really. How do we make it something for all? And the other element of that was getting the service users involved so that they feel like they own it. So I'll come a little bit more onto that. But the nice thing as well is how we link it up to existing tools and care plans. So we use it with we've got physical activity coordinator roles, and they will work with people on the wards, and they'll use this app and this tool as part of that programme. So somebody might go to the gym and they might do some yoga and a bit of mindfulness, but we might also then support them to go on a walk and encourage them to do that multiple times. And what we're really excited about is that we've also got, they've supported us with funding, that if people do this walk multiple times, there's a little bit of a reward system, so that we've kind of designed it that if somebody does it, because it's the very same walk, it's only a mile, but if someone does that 5 times, say, they can have like a meal voucher. So it's those little things of like, how do we then move that towards behaviour change? How do we get that as embedded in people's lifestyles? Because that's the next challenge, really. So going on from, I should tell you a little bit of background, sorry. So the Highbury Hospital site is a mile route. So the other exciting thing was that it's, you know, 1 mile, it's just around a car park and the back of a hospital. It's not very exciting. So the real challenge the guys had was, how do we make that interactive? People are used to the route, we take people on that route anyway, so how do we make that more interesting and engaging? How do we get different service users who might not want to do it and are like, that's not for me? How do we encourage them in as well? So that's been quite nice, being really creative and think about how we attract certain audiences and groups of people. And then we're also pulling staff on board. So obviously recent times and, you know, we're really encouraging staff wellbeing because there's a lot of staff burnout, so we're encouraging people to come off shift before and after lunchtime and do a mile because it's a quick thing. So how do we get the staff doing it as well? So that's our focus. And then I'm really excited about what we can do next. You know, the fact that you can change the content, You can make it more prescriptive. I like the sense of digital prescriptions, that the content could also be a bit of mindfulness and a bit of kind of relaxation technique. You could make it update it around certain themes like Christmas and Easter or like the Jubilee to pull people back on that walk. And we'd really love to see if it has an impact on mood. You know, does it make people move more, essentially? And does it make people feel a bit better inside? So we'd love to pursue that. That's the next step. And then ideally, because we've got multiple hospital sites, is to roll that out, because each hospital has its own unique base and character. So just a little bit more on co-design, because this I think was really lovely that so we've worked collectively, so we very much looked at the content and thought what was appropriate for our service users, but we also, in terms of the object identification and making the route more interesting, co-production is very much a focus in healthcare, in engaging people to feel like they have some ownership and have some sort of connection to the activity is really powerful. So we went on the wards, and our physical activity students went, and we were like, what objects, you know, would you like to do? And then we create these, like they kind of co-created their own sculptures. So that for us created a whole process where people were engaging in art, being creative, planning and organising, making decisions together, and then following that process through, then they then see it in location on the hospital site. And for some people, the lovely thing is they might not have much leave off the ward, you know, they might only have 30 minutes, but it's still an opportunity to feel connected to that activity, so we're not limiting it to anybody. Yeah, so thank you. I'll just pass back to Will.
Thank you, Jenny. So yeah, as mentioned, our second collaboration was with Nottinghamshire Healthcare and Research England, again based in Nottinghamshire, and it's called Tag for Active Lives. So it's based in Highbury Hospital's Highbury Mile. So research currently suggests that healthcare is a cause of inactivity, as Jenny mentioned. So we're currently planning to do a trial of the second app, which we're hoping is going to motivate staff and service users around the grounds and see if there is a benefit on the mental well-being. So this image, this line is currently the Highbury Mile, the walk around the grounds. And as it stands, it is currently very little, if any, interactivity. So what our biggest focus was to add in enough locations to get users to enjoy doing the walk. So we started by implementing the Tag Me locations, and these help users keep track of where they are on the walk in quarter-mile intervals. So they start at the beginning, and they get a quarter-mile, half-mile, three-quarters, and back to the end. We then implemented some of the Teach Me and Answer Me locations. So in this location, these work collaboratively. One of the locations, they are taught information about Highbury and the surrounding areas, so Bulwell or Nottinghamshire. And then at a different location, they are given the chance to test their knowledge with the Answer Me points. So what this does is it helps keep the walk interesting, as it can be randomised and enable the users to learn more and make it more replayable. Finally, we added the Scan Me locations. So these take two mosaics that are already in place around the hospital grounds and two areas filled with the papier-mâché co-design objects that Jenny mentioned earlier. So overall, there are 16 locations now implemented around the mile-long loop, and this has been designed to help motivate users and service users and staff members to complete the walk multiple times, and it also offers a non-punishing gameplay. So early indications are suggesting that the service users are finding the development really exciting and engaging, and they're definitely ready to go out and see their work when we launch an official trial shortly. So in the future, we want to continue to expand to other venues, such as museums, schools, and retail parks. So if anybody is interested in having a further chat with us or adapting to a venue, then we're over in the networking area, and we've got a pop-up and a few flyers and bits if you're interested. Thank you.
Okay, Thanks very much, guys. That was fantastic. Have we got any questions from the audience? We've got 5 minutes to do a quick Q&A. So has anyone got a question at all that they'd like to ask the guys? Sean, have you got them? Have you got a mic? Or are you you need to use this one? That's fine. I like sharing.
Thank you. It's a really interesting presentation. A quick question for Kieran and Will. Talking about expanding into new projects, how scalable is this? How easy is it for you to scale it up? Maybe not even just within Nottingham, but to be beyond, nationwide. Is the technology scalable?
Yes, I mean, now that sort of the underlying technology has been sort of developed and built, it is really just a matter of the content, because each of the locations are sort of venue specific, so like it does take advantage of the co-designed objects or the sculptures in a park. So, but it is just a matter of like changing the content really, rather than any sort of major technical challenges that would be encountered.
Just add to that as well, it's very convenient that the 2 locations we currently have both have 16 locations. It's not restricted to 16 locations. It's just kind of convenient it fell that way. You can have, if you just want a smaller venue, you can have 9, 10 locations, you can have 20, 30 plus. It's scalable in that way as well.
A very interesting presentation. My question was about, in terms of the data you're collecting, what are the plans for the insights that you'll be getting as you expand?
So it depends on the site really. So especially for sort of the hospital, it's lots of insights on sort of well-being would be useful to see if the technology can impact mental well-being as well as sort of the physical activity. But in most other locations, especially for sort of the tourist attractions, it'll be like the time spent at the venue to see if the app encourages people to stay longer and how far they're walking, see if they're encouraging people to walk further and explore more of the location. So it does kind of change depending on the venue, but they're sort of the main aspects.
Hello, my name is Arun Kumar. I'm from Stepstone. Just a quick question on 2 questions. One is whether you touched about the latency, about what are the advantage or what are the difference between moving to this area with respect to the latency. Second is whether what about the support or maintenance over there, because we go for so many locations, if something we haven't get the signal over there, what sort of things is there? So that they touched about the scalable. That's also one of the area for the maintenance and support as well. So my question is with the latency and support.
So yeah, in regards to sort of the latency, so because the AI is running in real time for the camera view, it's sort of very beneficial for that area because the AI model is sort of in the cloud. So because it's scanning every object that the camera sees sort of in real time, the reduced latency just helps it detect the object quicker. There's sort of no delay as you're using the app. As soon as you point it at the correct object, it's identified immediately sort of above the threshold, and then it's considered that you found that location and you earn the point and carry on. Sorry, what was the other question?
For the maintenance and support perspective, for example, you mentioned about so many locations, how when they mentioned about the scalable, how it's going to be a little bit more on support aspect and maintenance aspect?
So currently it's still relatively new, but we've sort of had sort of little maintenance required, but it shouldn't be a challenge really to maintain any of these solutions, especially if they're connected to the cloud, so we could monitor anything and detect anything that's sort of, if there is issues with any of the locations, and update content remotely. So maintenance shouldn't be a major challenge for any of the locations really.
Thanks for those questions, brilliant questions. Thank you so much, guys. I'm really excited about this project. I mean, I think as a big history fan, and I love going to castles and this kind of thing, I mean, if you can make those places come alive and tell those stories, I mean, I'd love to write those stories for you and work with your technology. So, yeah, I mean, it's fascinating. So thank you so much for sharing it, and yeah, good luck with it all.
Thank you very much.